Relief of choking.
Use abdominal thrusts learned in the adult section for children who are choking.
To relieve choking in a child, do the following.
Ask if they are choking. Tell them you will help. Stand behind them and wrap your arms around their body below the rib cage. Make a fist with one hand and place it just above the navel. Grab the fist with your other hand and deliver quick upward thrusts. Continue until the obstruction comes out and breathing is possible, coughing or speaking is restored, or until the child stops responding. If you can see a foreign object in the child's mouth and can easily remove it, do so. Avoid blindly sweeping the mouth with a finger, as it may push the object deeper into the airway.
Watch and feel for breathing to begin.
If the child does not respond or begin breathing, begin CPR and continue to provide it until additional help arrives. Large children may require chest thrusts if you cannot wrap your arms fully around the waist. In this case, perform abdominal thrusts with your fist on the breastbone. Any child who has had a severe choking event should see a doctor. If the child stops responding, lay them down and yell for help.
Check for breathing and begin CPR.
After 30 compressions for one provider or 15 compressions for two, open the airway and look for a foreign object. If visible, remove it and attempt to give a breath. Continue CPR until the child recovers or more advanced help arrives.